Welcome to The Explainer. Today, we're diving into something that's absolutely fundamental to any hospital experience, the care of patients standard. You might hear it called COP in the field. Think of it as the invisible but essential framework that's working behind the scenes to keep every single patient safe. So let's just jump right in with a big question. How does a place as complex as a hospital, with all its different departments, hundreds of staff, countless moving parts, make sure that every patient gets safe, effective, and compassionate care every single time? I mean, it seems like a huge, almost impossible task, right? Well, the answer really boils down to this. You have to have the right blueprint, a master plan that guides every single action, every decision that has to do with patient care. And that blueprint, that's exactly what the COP standard is. So what does this blueprint for patient care actually look like in the real world? Let's get into it. Okay, so here's the official take. The Care of Patients standard is all about making sure clinical processes are standardized, documented, and followed. But it's not just about one single moment in your care. No way. This covers the entire journey, from the second you get a diagnosis all the way through treatment, monitoring, and right up until you're discharged. The whole shebang.
But you might be wondering, why is having a standard so critical? I mean, can't we just trust doctors and nurses to use their best judgment? Why do we need this rigid structure?
Well, it's because of this simple truth. At the end of the day, providing quality clinical care is the absolute heart of what a hospital does. It's their entire reason for being. And to make good on that promise for every single person who walks through their doors, you absolutely need a system.
And the goals of that system are incredibly practical. First, it's about reducing variability in care, so your treatment doesn't depend on which doctor happens to be on shift. It's designed to prevent medical errors by building in safety nets. It also pushes for practices that are actually backed by science, evidence-based. And crucially, it's there to safeguard your rights as a patient and make sure your treatment is both on time and right for you.
So how is this whole thing built? What holds it all together? Well, let's look at its core components, what I like to think of as its 6 main pillars. Okay, so the COP standard really stands on these 6 key pillars. First, you've got clinical protocols. These are basically the playbooks for treatment based on the best science. Then there's documentation. You know the saying in medicine, if it wasn't written down, it didn't happen. It's that important. Informed consent is next, and that's what makes you a partner in your own care. Then patient monitoring, that constant watchfulness that helps catch problems early. Multidisciplinary care means your whole team is on the same page. And finally, emergency care makes sure the hospital is ready for anything, anytime.
All right, so that's all the theory. But what does this actually look like on a busy hospital floor, day in and day out? How does it come to life?
In practice, this standard is everywhere. Your doctor uses a standard guideline to plan your treatment. Your nurse keeps meticulous, clear records of everything. Before a procedure, you're not just told what's happening, you give your informed consent. When a shift changes, there's a detailed, safe handover to make sure nothing gets missed. And here's a big one. If something does go wrong, that event is reported, so the entire system can learn from it and get better. This brings us to a really important point. This standard isn't just for the hospital staff to follow. It's also about empowering you, the patient. So let's talk about the rights it gives you. This right here is the bedrock. It says that at a bare minimum, you have to be treated with dignity and respect. Your background, your beliefs, none of it should ever change the quality of care you get. It's a fundamental human right, right there inside the hospital walls. And it doesn't stop there. You are guaranteed other huge rights. You have the right to be told, in plain language, what's going on with your health. You have the final say, the right to refuse treatment or to ask for a second opinion if something doesn't feel right. And, of course, your privacy is protected. What happens in the hospital stays in the hospital. Now, let's be real. Putting a standard this big into practice isn't always easy. It's one thing to have a perfect blueprint, but it's another thing entirely to build it flawlessly every single day. Yeah, there are definitely some common hurdles. For example, sometimes protocols aren't applied the same way every time. The fix? Regular training and audits to keep everyone on the same page. What about messy or incomplete paperwork? Hospitals are shifting to electronic records and making sure staff are accountable. And if patients don't understand what's going on, the solution is better communication, using translators in simple, clear language. It's all about actively finding and fixing those gaps. So here's the most important thing to take away from all this. The Care of Patient Standard isn't some dusty old rulebook sitting on a shelf. It's a living, breathing framework that's always being watched, challenged, and improved. It has to adapt to new science and new technology to make sure it's always delivering the safest, most effective care possible. Which brings us full circle, back to our first question. The answer is the COP standard. It's that powerful blueprint for safety and quality. But the real challenge, the real question, is how we make sure that blueprint isn't just a document, but a living reality for every patient every single day. That's the dedication that really separates good healthcare from truly great healthcare. Thanks for joining us on The Explainer.